Hi everyone, my name is Peggy Chukwuemeka from Nigeria, and then I am speaking under the umbrella of the Vienna NGO committee. My topic is on the abuse, illicit cultivation, production, manufacture, and trafficking in illicit narcotic drugs and psychotropic substances. And so cultivation, production, manufacturing of illicit drugs and psychotropic substances and abuses, as well as trafficking in Nigeria, has quite increased despite the existing drug laws, policies, and strategies for prevention. And in recent years, Nigeria has witnessed an increase in the production of meth within its borders. And the Nigeria criminal network has been involved in the clandestine manufacture of meth, often utilizing makeshift laboratories and precursor chemicals imported from countries like China. And Nigeria drug traffickers have also established connections and collaborations with transactional criminal organizations such as Latin American drug cartels and West African criminal network. And this enables them to access global market and sophisticated smuggling techniques. The significant amount of drug confiscated by the revitalized National Drug Law Enforcement Agency (NDLEA) from drug traffickers at Nigerian airports over the past 2 years provides a vivid insight into the unfortunate predicaments faced by the young people in Nigeria. No wonder why we have the rising number of young individuals who find themselves entangled in addiction and dependency issues. There are also evidences of states in Nigeria that have been assessed as being at highest risk for cannabis cultivation, which in some other states there are evidences of some communities or families cultivating cannabis in their backyards, as well as a scattered cultivation of cannabis in their forests areas, and all of this contributes to overall cannabis production in Nigeria. And so currently, across streets of major cities and communities are free buyers and sellers of various varieties of illicit drugs and psychoactive substances. And some of these locally produced illicit substances are unbelievably very cheap and readily available there, particularly among youths. And sadly, these sellers are also traffickers with full spring locally and internationally. These substances range from diazepam to refonol to marijuana to meth to heroin to cannabis, cocaine to Colorado to codeine, opioid, tramadol, and other psychotropic substances. Most of these illicit drugs and substances have street names like Molly or X, Rufus, Banku, White, Thailand, Eyes, Schoolboy, Little C, Upper Speed, Special K, Acid, Loud, Arizona, SK, Kosh, Scotias, and among others. And while the local drug scene is becoming more aggressive and expansionist in grappling new markets, the international drug cartels are arming their local agents with ever-changing distribution patterns, which with increasing skills in consignment and in handling the money from their sales. So it's important, therefore, to know that tackling drug consumption requires a long-term commitment, adequate resources, and multi-sectoral approach involving the government, civil society organizations, and healthcare providers, educators, families, and communities. By combining these strategies, Nigeria can make significant progress in reducing drug consumption and its associated harms. At Parent Child Intervention Center, a civil society based in Nigeria, we invest more in evidence-based prevention, working in collaboration with communities, government, families, religious bodies, and our preventive measures target youths, particularly high-risk groups such as vulnerable youth, school dropouts, and marginalized communities. Our recommendations, therefore, is that we understand that the illicit drugs trade in Nigeria is fueled by our geographical location, economic disparities, unemployment, poverty, which has spiked up by the current fuel subsidy removal, political instability, and global demand for drugs. We therefore recommend that the government should address the underlying social and economic factors that contribute to drug abuse, including poverty, lack of education, unemployment, and inadequate social support. There is need to strengthen collaboration and cooperation with international organizations, neighboring countries, and partners involved in drug control efforts. They should engage the local communities, religious organizations, and civil society groups, and other stakeholders in drug prevention. And then with that, we know that Nigeria would go over the drug demand. And of course, when demand is reduced, production is definitely going to come down. Thank you very much.